Greetings, everyone. I wanted to just talk about breastfeeding and my experience and maybe little tips that'll help, because these are key tips that helped me to breastfeed for 14 months. The first 6 months were exclusively breastfed to her. The first 6 months, my daughter, my third child, was exclusively breastfed from the breast. And these are key things that helped me to achieve that. Eventually, we had to start her on food, so, there goes the exclusive breast milk thing. The first thing I do or learned is offer the breast. Offer the breast. If the child is crying, it's already too late. If they're crying, they're hungry, and it's already too late. There are key signs, and for her it was mouthing things. Like she was, I guess, like she was talking or chewing or pretending to talk. She would just move her mouth, and that was the key for me to know, hey, I should offer her the breast. And when I start doing that, I noticed she would take more milk, go to sleep, and sleep longer. So offering the breast. But first and foremost, I should suggest that you get a lactation consultant, is what I should have done. A lactation consultant can help you. They're professionals. I think there are some that are available for free. So check that out, a lactation consultant, okay? Consider modesty when breastfeeding, because for me, I am quite modest. I'm a little older, so sometimes that goes out the window because of, function over form, I guess. But think about that I personally do not like the idea of covering up my child's face. I think that is a shame that I feel that I'm putting off on this child, and so eventually she starts to cater to that and starts to feel and react to the shame. And what she started doing is, when I would cover her face in public, is she would rip it off. So consider, the modesty aspect of it. Commitment and flexibility. Now, you'd have to be committed to do this. You make the choice to do it and stick it out. Make that choice and stick it out. But don't be so committed that you're stubborn and you neglect yourself, because some medications you may have to take, you can't take while you're breastfeeding, or you can't breastfeed while you take. So depending on the severity of the situation for yourself, you have to be flexible enough to know what to do for yourself. Another tip that I learned is oatmeal. Oatmeal increases breast milk. The amount, I'm not sure if it, what it does with the quality, but I know that it increased the amount of breast milk I had. And I prefer oatmeal because, unlike the mother's tea, when I don't eat it or ingest it, I still have breast milk. When you drink mother's milk, it increases your breast milk only for the duration that you're ingesting the milk. Outside of that, you're going to deplete in the amount of milk that you have available if you don't drink the milk. So it's something you have to do daily, and it doesn't progressively increase your milk. Like as the child starts to drink more, I noticed that I was making more than before, but not more than I'm making now, if that makes any sense. So it doesn't steadily increase. I guess you'd have to increase the dosage of tea in order to increasingly increase the amount of milk. Chapped nipples, consider that. Chapped nipples are very painful, and if your baby is latched on wrong, you will end up with chapped nipples, and it is horrifying. I had chapped nipples, and I did breastfeed through the chapped nipples. My doctor said it was okay if they bleed to feed through the bleed. I personally just I wouldn't want milk with blood in it. That's why I don't drink cow's milk. So I wouldn't give that to my daughter. I would feed her off of the right breast, and honestly, I used the Lanacel, and that helped to it helped a lot. And in a couple hours, the bleeding would stop, and then I could feed her from my left breast. And depending on how rigorously she fed, it may not start bleeding again. But if it did, I took her off, and then I would use the Lanacel again. Also, don't use soap on dry nipples. Do not feed your baby on dry, ashy nipples. That will create cracked nipples. So you can use the Lanacel. It's in a yellow package. I'm not sure of the exact name of it, but yeah. When I first started, I had to deal with thrush. And thrush is a yeast infection of the mouth. The reason, I was eating too many sugary things. I was eating donuts and stuff like that because I was very concerned at first with being nutritious, eating healthy, doing the right thing, and then I fell off the bandwagon, and I fell off hard. So I had like soda, and I had donuts, and then I got thrush, and it was terrible to see my baby's mouth turn white like that. And because my baby was not even 2 months, no doctor would see her because she was too young. And I didn't know at that time, if you have a problem, while I think within the first 6 weeks, you go back to your gynecologist that you were seeing for your prenatal, for your appointments, and they can actually prescribe you something for the child if need be. So you can actually take your child to your OBGYN. Thrush teething. Also consider teething. Yes, she's teething, and she has 4 teeth, and she's getting 2 more. And when she first got those teeth, she nipped me once. And I quickly took the breast away from her and told her no, because she looked like, what happened? And I said, no, you don't do that. And I ignored her for a second. I didn't make any eye contact, and maybe a minute or 2, and then I came back. So, and after that, I think she realized she did something wrong because she didn't even ask for the breast immediately. But that's something to consider. Sleepy. Breastfeeding can make you sleepy. Are you done? Are you done? Are you done? Breastfeeding can make you sleepy. So, keep that in mind. And you got to make sure that you have enough calories to produce breast milk. And I think maybe that's why we have that hunger, that insatiable type hunger when we are breastfeeding. I breastfed 3 girls. My first one I breastfed for 6 months. And she was huge. She was a really big baby. She was only 5 pounds 10 ounces at birth, but she got big really fast on breast milk. I did use bottles with her. She had no nipple confusion. She was fine. My second daughter, I breastfed for 4 months, and I mean 4 aggressive months of breastfeeding. And it was actually more than my body could keep up with because my milk dried out in 4 months. I didn't have enough calories. I wasn't taking in enough calories. I didn't know at that point, the holy grail for breastfeeding is oatmeal, which I may have mentioned. I think I did. Oatmeal, that's why, I prefer oatmeal over tea. If I would have had it, I'm pretty sure I would have been able to sustain the breastfeeding longer with her, but it's okay. I learned. And this time around, this is 14 months. There are so many things that I've considered and learned about myself. I learned how selfish I was, a lot more than I would like to admit. I learned that little things such as traveling in a car a new car, a rental car, that it's sprayed with flame retardants is not healthy for your milk. That stuff gets in your breast milk. Going outside into polluted air or a situation where you really ought not be is really bad for your milk. All these things you have to take in consideration if you want to preserve the quality of your milk. So yeah, that's it. Other than that, I don't know. I mean, as far as how to, it's really a commitment, and you really want to make sure that child's mouth is as close to the outside of the areola as possible, because the nipple needs to go back in the back of the mouth, and the gum should never rub on the nipple itself. It will cause chapped nipples, among other things. So, and with chapped nipples, you run the risk of getting an infection. So, stay at it, and happy breastfeeding.